Blueprint for Health calls for the creation of patient-centered medical homes, supported by community health teams, working in conjunction with public health services to improve the health of both individuals and populations.
So what a patient-centered medical home really is high-quality primary care, high-quality preventive care, great access for its patients. Do they really have the ability to get in and get the health care they need when they need it? Is the care they get really well coordinated? Do they communicate well with the families and the patients that come to them? Do they follow up closely? Do they track things carefully in electronic systems? Do they manage a population by pulling reports and looking at all the people who are missing tests or need assessments or who haven't been in?
The Blueprint changes the incentive structure for healthcare providers. All of the payers, including insurance companies, Medicare, and Medicaid, pay into a system to provide incentives for practitioners and to fund the community health teams that support those providers. Rather than being rewarded for volume, patient-centered medical homes are reimbursed based on how well they are evaluated according to national standards.
Every practice in the Blueprint in Vermont is scored against these standards by a team from the University of Vermont. That then makes them eligible for the payment reforms that help support that high-quality care.
The patient-centered medical homes are supported by community health teams.
So the community health team has nurses, social workers, registered dietitians, health coaches, and other supports. We looked at our resources in terms both of our community resources and also what the clinics had and needed. And then we said, what does our community have in need? And then started to develop it based on that.
Sometimes, team members are embedded in primary care practices.
Hey, my name's Chelsea. I'm the chronic care coordinator. Nice to meet you. You too, Jessica.
We have the care coordinators and the behavioral health specialists. Most of them are nurses as well, and their role is different from the typical office nurse. The care coordinators have the time to sit and talk with the patient and find out what else is going on in their lives.
I really don't want to go on the medicine, so if you really feel like this would help, I feel very confident.
In addition to having community health team members embedded in patient-centered medical homes, team members may also be available in the community. These community health workers assist patients with health education and non-medical social supports that may affect their ability to receive health care.
Yeah, I may lose the health insurance I have at my job. They cut me back.
Yeah, that's what I understood.
I'm back to part-time now, and my wife's really worried. She's disabled, and it may really affect her not to have the insurance.
Okay. You know what we could do? We could apply for Social Security disability if you wanted to.
We've found that by working together, partnering, and wrapping people with services, we're preventing crisis, where you really do get a chance to look at what's going on with folks, because they can't concentrate on their illness until the rest of their life is stable.
We really look at it as a partnership with the providers, the doctors and nurses in the medical home. We meet regularly with them. We communicate via the electronic health record. They send us referrals on their patients that they think could benefit from help with any number of issues.
Many communities also take advantage of community health team extenders to support more targeted subpopulations. The Support and Services at Home, or SASH program, helps older adults to live and age safely in their own homes.
Welcome home, Audrey.
Thank you.
How are you doing?
With the SASH program, I think they filled a need. I had a fractured ankle, which arthritis is set into now, and I have Parkinson's. And there's a lot of stuff available here. I didn't have the courage to go there and see until I got into this program.
The Blueprint for Health also supports Healthier Living Workshops, a series of classes that empower participants to better cope with their symptoms through peer support and skill-building exercises.
Gardening is completely foreign to me, but I decided that I would do 1 hour every other day as a realistic goal, 2 to 3 times a week. And I haven't quite gotten it together to do it every other day.
And that's part of the self-management skills, that sometimes life gets in the way, doesn't it? We might have the best plan.
The Blueprint support for local innovation is clearly evident in the functional community health team.
We have a community really rich in resources, not a lot of money, not a lot of funding, but a lot of people who really care.
This broad group includes local community health and human services programs, including nonprofit organizations and public health programs.
I'm Karen Stewart. I'm the acting district director for the St. Johnsbury Vermont Department of Health office, and I'm also...
By coordinating with this larger group, the core community health team can leverage enormous resources to help provide expanded services for their patients.
And so one of our interests is to provide some kind of a program for high school students who are already engaged in drug and alcohol use.
They can also work with this larger group to support the development of new services in their community.
So as we looked at St. Johnsbury, thinking, what do we have around here just for teens where they could come and feel safe and talk about their issues and try to work through some of those. And we couldn't really think of anything that we specifically have, so we thought, well, why don't we see if we can start something?
The Blueprint connects patient-centered medical homes and multidisciplinary community health teams with public health resources and health IT infrastructure.
The role of public health in the Blueprint for Health has been a really important one, and it brings that broader point of view about how we think about the health of the whole population and well beyond the scope of just primary care.
This is the kind of work that is really starting to get clinicians and public health officials talking across the board and talking together about how their work can be beneficial each to the other. I'm now hearing clinicians talk about the social determinants of health, and I never would have heard that 10 years ago. And I'm hearing people in the public health arenas talk about the value of the clinical care and how public health needs to support it.
The Blueprint model encourages healthcare providers to use electronic medical records. The Department of Vermont Health Access is building the IT infrastructure needed to collect health information from the electronic medical records of healthcare providers into a health information exchange. This exchange can then interface with a central clinical registry, which can provide data back to healthcare providers, community health teams, and public health policymakers. This data can enable visit planning, better care coordination, and more accurate reporting.
The importance of the Central Clinical Registry and the health information infrastructure that we're talking about with the Blueprint can't be overstated in terms of improving care and also helping us understand where are the next things that we need to focus on as a system.
The real idea here to help achieve the Institute of Medicine's vision for a learning health system is that people, just by going to work every day, electronic medical records capture information. A multi-payer claims database is capturing information about the quality of healthcare and healthcare expenditures. They're able to capture very important information, and we needed to bring that information together into systems where it could turn into knowledge.
I can give you an example. The care coordinators located in the medical homes all have access to their patients who were seen in this hospital. So they get those lists automatically every morning. And then they can see who of their patients were in the hospital and they can follow up. And that's just seamless. It just happens.
And that knowledge then is available back to the practices, back to the communities, so they can continuously see how they're doing and set goals and try and improve against that information. That's a learning health system.